Most people with neuropathy are doing one thing right. They found a B vitamin supplement, they're taking it every day, they're being consistent, and yet their nerves still aren't improving. Here's why, and it has nothing to do with the effort or discipline. The B12 in your supplement might be completely useless to your nervous system, not because it's fake, not because the label is lying, but because it's in the wrong form, and your body can't convert it efficiently enough to matter. Today, we're going to fix that. I'm going to show you the research on why combinations outperform individual nutrients, why the form of a vitamin is often more important than the dose, and then give you concrete 3-stage action plan you can start today. My background is peripheral nerve surgery, and I now work with people online who've been told there's nothing they can do about their neuropathy. What I've learned from the research is that most people are not failing because they're trying the wrong things. They're failing because they're trying the right things in the wrong forms. That distinction matters. Let's get into it. Here's a question we're sitting with. Why would your body need 5 different nutrient systems working simultaneously to support nerve function? The answer is that your nerves are extraordinarily expensive tissues to maintain. They require constant energy production. They need intact myelin, the insulating sheath that controls signal speed. They depend on functional neurotransmitter pathways, ongoing anti-inflammatory signaling, and the ability to repair and extend the nerve fibers when conditions are right. No single nutrient owns all of that. Each one addresses a specific rate-limiting step in a shared biological system. Think of it like a production line. If one station breaks down, it doesn't matter how efficient the others are, output stalls. B vitamins work the same way. B1 fuels mitochondrial energy in nerve cells. B6 handles amino acid metabolism and neurotransmitter synthesis. B12 drives the methylation reactions your body uses to build and repair myelin. When one is deficient, the others can only compensate so much. They're complementary, not redundant. This is where it gets interesting, because there's actually controlled research on this question. In laboratory studies using nerve cells and Schwann cells, the specialized cells that support your nerve fibers, researchers exposed those cells to oxidative stress, the same kind of metabolic pressure that's present in chronic neuropathy. They compared individual vitamins against a combination of B1, B6, and B12 given together. The combination outperformed every individual vitamin on 3 specific measures: cell viability, cell maturation, and network formation, meaning that the nerve cells survived better, they developed more normally, and formed more connections when all 3 were present simultaneously. But the finding that surprised me the most was this: neurite outgrowth, the actual process by which nerve fibers extend and form new connections, was specifically enhanced in the combination group. That's not a generic better together result. That's a measurable structural difference in how your nerves grow. The reason this happens comes back to that production line analogy. Each B vitamin removes a different bottleneck. So when you supply all 3, you're not just adding nutrients, you're removing multiple points of failure at the same time. This is the part of the conversation that I find most people have never had with their doctor, their pharmacist, or anyone else. 2 supplements can list the identical vitamin on the label, same milligram dose, same ingredient name, and behave completely different inside your body. The reason is bioavailability and conversion. The form of a nutrient determines how efficiently gets into your cells, how it distributes through your tissue, and how many enzymatic conversion steps it needs before it's biologically active. Let's go through 2 examples that matter specifically for neuropathy. Let's take a look at vitamin B. It comes in 2 forms: thiamine and benfotiamine. Standard thiamine, the version in most basic B complex formulas, relies on active transport to cross cell membranes. That transport system has a ceiling. At higher doses, it saturates, and the rest of what you swallowed passes through. Benfotiamine is a fat-soluble derivative of thiamine. Because it's fat-soluble, it crosses cell membranes more efficiently and raises functional thiamine concentrations inside nerve tissue more reliably than standard thiamine can at comparable doses. This is the same vitamin, just meaningfully different behavior in places that matter the most. Now let's look at vitamin B12. This comes in 2 forms also: cyanocobalamin and methylcobalamin. Cyanocobalamin is the synthetic B12 form in most mass market supplements. It's inexpensive to manufacture. It's also chemically stable. which is why it's everywhere. The problem is that your body needs to convert cyanocobalamin into methylcobalamin before it can be used in the nervous system. That conversion requires enzymatic machinery, and some people, particularly those with certain genetic variants or digestive issues, don't convert it efficiently. Methylcobalamin is the biologically active form. It participates directly in methylation reactions and myelin-related processes without requiring those prior conversion steps. When you're evaluating a nerve support supplement or your current B complex, don't just look at the ingredient name, look at the form. Make sure it's benfotiamine, not thiamine, and look for methylcobalamin, not cyanocobalamin. Those are not interchangeable, and the label won't always make it easy to tell the difference. I want to give you something now you can actually use. These are 3 specific stages based on what we've covered. So today, take a look and audit your current supplement stack. Pull out everything you're taking for nerve support and look at the actual forms, not just the names. Is it thiamine or benfotiamine? Are you using cyanocobalamin or methylcobalamin? If you can't find the form on the label, that's usually not a good sign. At the same time, start thinking about every meal through the lens of blood sugar stability. Glucose dysregulation puts direct pressure on mitochondrial pathways in nerve tissue. This is one of the most consistent and overlooked drivers of ongoing nerve stress, and it starts at your next meal. Something to do this week: increase omega-3 intake. Fatty fish 2 to 3 times per week, or a high-quality supplement. Omega-3 support cell membrane integrity and reduce inflammatory signaling that can worsen nerve function. Also, add anti-inflammatory foods across your meals. These would include things like leafy greens, turmeric, berries. These aren't magical, but they shift your metabolic baseline in a direction that's more favorable for nerve maintenance. And get consistent sleep. This is not optional. Nerve growth factor secretion and myelin repair are sleep-dependent processes. If your sleep is fragmented or insufficient, you are actively limiting your nervous system's repair capacity, regardless of what else you're doing. Something to do this month. Ask your doctor for baseline labs, specifically fasting glucose, hemoglobin A1C, B12, vitamin D, and magnesium. These numbers tell you which metabolic stressor may be actively working against your nerve tissue. And once you have that data, you can build a strategy around what's actually happening in your body, not guesswork. If you want a framework that puts all of this together, what a well-designed nerve support strategy looks like based on this biology, I put together a free guide at DrFitzNutrition.com. It's the starting point I give to most people I work with. And if you want to look at the specific formulation I developed around these 5 pathways, using things like benfotiamine, methylcobalamin, alpha-lipoic acid, and several other compounds that we've discussed in this series, it's called NeuroAxis. It's also on that site. It's a tool designed around this specific biology, not a generic nerve supplement.